Welcome back to Alive and Well Community's Daily Dose, your daily dose of support. And as we're continuing to think about how to take excellent care of ourselves, again, our physical health is part of this conversation. And we know that taking excellent care of our health includes our reproductive health as well. So we are joined today by Jessica, who's going to share with us how we can take care of our reproductive health during this time of COVID. So, Jessica, thank you so very much for joining us this morning.
Yeah, thank you so much for having me.
So, with our audience, I just want to share a little bit about Jessica. Jessica is a family nurse practitioner with a local Planned Parenthood. And so she is going to be talking to us about how we can make sure that we continue to take care of our health. And as we said before, a lot of times our reproductive health may be an afterthought. But Jessica, it's really important that we continue to take excellent care of ourselves, including our reproductive health.
Yeah, absolutely. Our reproductive health is, it's not just, as humans, we're not just our heart, we're not just our lungs or eyes, we're a whole person, and that includes reproductive health and our sexuality. And I think right now there's a lot of questions from patients regarding, preventative visits and what do I do if there is a problem and how do I navigate that? And those are things we'll definitely go through today. But yeah, overall, reproductive health doesn't necessarily need to take a back seat. It just may look a little different right now.
So let's start this conversation. If someone may be due for their annual exam, is that something that they want to then just put off?
And the annual exam is one that comes up really frequently right now. People get on a
Hmm.
schedule and they know, this is April and it's always in April. And if I don't get it done, is that an issue or is that going to affect me long term in my health? And I think that's an excellent question. And right now, unfortunately, that's not an essential healthcare, but it's something we want to make sure we still keep in mind. So a lot of times during our preventative visits, we're going over not only reproductive health, but also our health history, things we can change in our lifestyle, whether that's smoking, diet, exercise. So those are all things to think about. Maybe if you can't go, what are things we can reflect on to change or maybe make better as far as our choices? But the reproductive health part of it, as far as like breast exams and our pap smears are what we do cervical cancer screening with. Cervical cancer is very slow growing. So if we have to postpone the pap for 6 months or even a year, it, it's very low likelihood that you're going to have a poor outcome because in a year we're still going to be able to catch something and do the appropriate care for that. So if we have to postpone it, it's okay. But if there is like a breast lump or some other type of issue, we still want you to come in and get seen.
Yeah. So before someone makes a determination of, oh, should I put it off or oh, should I go in, would you advise that they call their practitioner to just kind of seek guidance about what to do for the individual?
Yeah, if you call our call center, the Planned Parenthood call center here in St. Louis, there's a lot of triage process put into place as well. So as far as if I'm having abnormal bleeding, do I need to come in? And that's a yes. We want you to come in and get seen. That needs an exam, and that's abnormal. I have a breast lump. Yes, please, by all means, come in. But if it's a preventative visit and it's just kind of a wellness checkup, you don't necessarily need to do that. But a lot of times during those wellness or annual visits, we're going over, birth control refills and things like that. And that's something we can do remotely now. And we have, really good platforms in place to do that. So we have the Right Time Grant, which is a fantastic grant that I think we have had now for about a year. And it covers really any birth control if you're underinsured or uninsured. And we can do that over the phone or even kind of a video type of interface and just do a birth control refill there where we can just send you your birth control if it's a pill, patch, or ring. And then if it's a depot, which is a type of shot that lasts for 3 months, you can come in to clinic and it's a pretty shortened visit and we can provide the shot for you there. The other two platforms we have are In Touch, and it's just a face-to-face telehealth visit again, but we can go over a little bit more in-depth things. And then there's also the Planned Parenthood Direct or PP Direct app platform, which you would download the app to your phone. And there isn't any face-to-face video chat on it. It's mostly chatting back and forth and questionnaires. So it's kind of limited in what we can do. But we can fill birth control, pill, patch, or ring, and treat uncomplicated UTIs as well with that. So there are different ways of getting care now. And it can be kind of confusing. So a lot of times calling into our call center and we can direct you where you need to go.
And you highlighted something that I think is of crucial importance. So if someone's insurance status changes during this time, because
Yeah.
unfortunately we know that some may be facing economic hardship, either losing insurance or being uninsured. This isn't something that we want to put off. We know that Planned Parenthood is there to help support individuals despite ability to pay.
Yeah. And I think that's a really big piece moving forward. With pre-COVID, we already had a lot of healthcare disparities in our community. We're seeing with COVID that especially people of color, our Latinx and Native American communities are being affected by COVID even greater as far as mortality and morbidity. But also, we need to think about this as after all of this, after job loss and insurance loss, and impacting certain communities more, how are we getting care to those folks? And I think a lot of that is Planned Parenthood has a lot of grants and resources in place, but it's also working with people financially. Um, so I feel like we do a really good job if you can't afford the full payment for a visit. We do a lot of sliding scale, but a lot of also working with folks as far as how do we make this care affordable for you.
No, that's such an important resource to promote for our community, recognizing that oftentimes during economic restraints, we put our health care on hold, but knowing that we have options available is always important to highlight and recognize.
Yeah.
Now, you mentioned that if someone may be due for a contraception refill, that's something that they can get processed over the phone or via televisit.
Yeah. So we have um, three different options. Like I had said, the PP Direct is an app, and if you have insurance, a lot of insurances unfortunately are not paying for that service, so it may be an out-of-pocket expense using the PP Direct app. And you also need to have an active credit card, so that can also be limiting for some folks, but it can be good for other people depending on where they're at financially and just with resources. The Right Time Grant is something we're still doing over kind of a telehealth visit where we're either video chatting or having a phone call interview type of thing, and we go through risks, health history, what works for you, what hasn't worked for you in the past, and kind of safety things as far as smoking history or history of blood clots, those type of things, and we can find the right birth control for you. We're not currently doing IUDs and implants, which are the longer term contraceptives, but we're starting to schedule those out now. So hopefully we'll start seeing those end of May. But when everything kind of was shifting, that's something we kind of had to pause for a little while, but we're hopefully getting that up and running again. But if you need a birth control refill or a birth control restart, if it's the pill, patch, ring, or depot shot, that's something you can absolutely take care of and make sure that you get.
Wonderful. Now, we know one of the biggest misnomers is that when we think about reproductive health, that we only think about women, but we know that that's not actually the case. What is it that men need to be aware of during this time about their reproductive health?
Yeah, and I think that's a really great thing to focus on because it's women and men are still coexisting and living together, and people are still sexual beings, and sexuality is still something that is part of our whole health. And men's reproductive health is just as important. So making sure that if you're having any symptoms of anything, burning with urination or discharge or any type of skin changes, lesions, things that are just abnormal for you, we do problem visits still for men. So if there's something that's popped up that's abnormal for you, we're more than happy to take care of you as well. There is for every patient a type of a screening process just to make sure No fevers, any type of the COVID type of symptoms prior to coming in, because we don't want to put other patients at risk. So those are things that they will definitely ask you prior to, no matter if you're male, female, non-binary. So those are all things to expect on the way in. But if you're a male patient, we can absolutely take care of any type of problem or abnormal symptom that comes up for them when it comes to reproductive health.
No, and it's also great to know, regardless of how you may identify in terms of your gender identity, your gender expression, that Planned Parenthood has services available for you.
Yeah, and I think it's a safe space too. I think I've encountered a lot of patients in my practice so far that maybe don't feel as comfortable in other settings because it's maybe not as inclusive. So I really like to think that we're a safe space for all folks, especially those maybe that don't identify as male, female.
Wonderful. Thank you so much. That's really important to highlight. Also, as we think about resources available for all in our community, for all of us to stay alive and well. Now, we know during this time of COVID, sometimes we get questions about what resources may be available, including abortion services. Now, if someone is making the determination that an abortion might be the best route for me, are those services still available in our community?
Yeah, they absolutely are. So the Planned Parenthood St. Louis region in Southwest Missouri also covers part of Illinois. We have a newer clinic over in Illinois that I'm sure people have heard about. It's a large, very beautiful clinic, but we're doing both our medication abortions up to 11 weeks and then our surgical abortions as well. Unfortunately, right now in the United States, a lot of states are limiting abortion care services and deeming them non-essential. However, abortion care is essential. It's very time sensitive, and a woman's right to choose what if she wants to have a child or not is essential, and that really will dictate how much autonomy and and um, and really what her future looks like. And right now, I think that's even more important, being that there is a lot of uncertainty and there is a lot of economic hardships and other things of that nature coming down the pipeline, and we're also all experiencing right now. So abortion care is essential, and I'm very happy to say that we're still providing that. And we also have patients coming from other states that are not providing that, and I'm glad that we can give that service still.
So recognizing that a woman's options aren't limited during this time of COVID.
Yeah.
No, that's important to recognize. So I just want to ask, are there other common questions that you're hearing from patients calling in, whether they're established patients or they're patients interested in getting services during this time? What are some of those common questions you're getting, Jessica?
Yeah. A lot of questions I'm getting are we still doing STD screening? Not necessarily doing STD screening if you don't have a symptom, just because you coming in and maybe not necessarily having a symptom could put others at risk. But if you're having any type of symptom or anything that's abnormal, we're definitely seeing those patients and screening for STDs then. We're hoping that that will change here soon and start doing hopefully some like mail out type of kits for STDs or those type of things, so it can be a lower risk for COVID transmission. But we're not quite there yet, but hopefully that's coming soon. So STD, testing is still there, but it's just one of those, it needs to be with a visit that is a problem visit. And problem visit, again, can be anything from discharge, irritation, irregular bleeding, or skin changes, and even breast health too. So if any of those, if you're there being seen by a nurse practitioner or provider, then we're absolutely doing the STD screening as well. A few other questions I've gotten from especially younger folks, what does my risk of transmitting COVID or getting COVID look like with having sex. And really, there's a lot of unknowns with that still. If you're, you know, if you are sheltering in place with someone and you're both sheltering in place, it's obviously a lower risk. And if it's someone that you're not sheltering in place with, obviously a higher risk. But the fact that you're so close in close proximity to someone, it can always happen. Um, and then there's also the idea of, um, other ways of having human sexuality, and that can sometimes be, over, an app um, or some type of text message. But consent is always still very important in that, and knowing that pictures you take or videos you take are also something that needs to be discussed, and there needs to be consent with that and how that's used. So for younger folks, just being really cognizant that right now things you're doing could still affect you depending on how you're using those platforms and expressing your sexuality.
No, and you highlighted such a very important issue that consent is always crucial. It's never an option. It's always something that's crucial. And even if we may be engaging in sexual behaviors using technology, that consent is still key and necessary.
And it's changed. How we're interacting has changed. So it's not something that I think is always implicit when you're having that conversation with someone. But it should be, no matter what. But I think some people have this disconnect that it's over text messages or it's over a phone or an app, so it's different. But it's not. It's still consent is still necessary, and also consent can change over the course of a conversation or an act or anything like that. So I think um, that's a hard conversation to have. But I think it's a very necessary one, so everyone can kind of walk away from whatever happens not feeling negative about that experience.
Yeah. And I couldn't agree more that not only is consent necessary, but recognizing consent can change over the course of a conversation or interaction, and that's completely okay. And that's a choice that you can change your mind about consent during that interaction.
Yeah.
Well, wonderful.
Um, yeah. Sorry.
No, please go ahead.
Oh, I think another thing that I kind of wanted to touch on at least was, right now I think there's a lot of talk about, disparities in healthcare. And, I'm hoping that, moving forward, I know Planned Parenthood is being very cognizant of, how we're going to slowly reopen things and making sure that we're being as equitable as possible, and also making sure that, we're prioritizing people's care depending on what they need from us and how urgent that care is. But I really hope that as a community as well, that it's something that we keep at the forefront of how we reopen everything, and hopefully being as mindful to folks that are already experiencing healthcare disparities and social disparities, and making sure that we're putting some safeguards in place for them. And I really feel like Planned Parenthood is doing a great job about doing that mindfully.
No, that's really important to highlight that equitable approach, that equity-centered approach, and in ensuring that we have an alive and well community. So, Jessica, I want to say thank you so much for all the wisdom that you've shared with us about resources available in our community, and letting us know that, despite our healthcare status, that we can still prioritize our health. So it looks like on my end, we're having some technical difficulties. And let's see if we have Jessica coming back at any moment to join us. But we want to say a very special thank you to Jessica for sharing all of this wisdom for us with us. Remember that part of being alive and well means taking care of our health, including, not excluding, but including our reproductive health. So with that in mind, we want to encourage you to think about how is it that you're taking care of your physical health during this time. So we want to say a very special thank you to all of our viewers who tuned in. And please be sure to tune in tomorrow for another episode of the Daily Dose. We'll see you back here for some yoga.